Mr. President, maybe it's the time I turn on my television, but it seems to me that I just can't escape drug advertising on television. It just comes one after the other. All kinds of drugs, many of which I couldn't even pronounce their names, can't remember their names, can't remember why they're being advertised. And then I listen to all the things that follow when all these drug ads come on. My favorite of all time is one of these drugs in which it says, be sure and tell your doctor if you've had a liver transplant. Be sure and tell your doctor if you had a liver transplant. Imagine going to the doctor for a checkup, a physical, talking about your condition, and failing to mention you had a liver transplant. That's what one of the ads says, and many of the ads are just as baffling as to the warnings and side effects. Don't take Xarelto if you're allergic to Xarelto. Well, how will I know if I'm allergic if I don't take it? So many questions, so many warnings. So how many other countries in the world do you think go through this? How many other countries in the world where you turn on the television and you get ads for drugs? Must be a lot of them, right? Nope. Turns out there's only one other country in the world that does this. New Zealand. The United States of America and New Zealand are the only two countries in the world that allow direct-to-consumer pharmaceutical advertising. You ask yourself, when did this come about? It seems relatively new, and it is. It was legalized in 1985, this direct-to-consumer advertising, but it didn't take off until 1997. That's about 20 years ago, when the Food and Drug Administration eased the requirements for detailing the side effects of the drugs that were being advertised. And the drug companies, after the FDA made that ruling, decided to dive into this in a big way. Now you see these fancy commercials with popular music, celebrity actors, golf clubs, lofty treatment promises. Every hour on television, an average of 80 drug ads are aired. The average American sees 9 of these pharmaceutical ads every day. 9 of them. In fact, drug companies spend more each year on advertising and sales than the entire budget of the Food and Drug Administration. These ads saturate our airwaves so much that there's now a national conference on drug ads and a Hall of Fame for the best drug ads. Can you believe it? As common as these direct-to-consumer ads are, drug companies spend 4 times as much as the cost of these ads on an army of sales representatives who target doctors who write prescriptions. These companies in America spend $20 billion a year trying to get these drugs into the doctor's offices and get the doctors to prescribe them. I once talked to a young lady who did that for a living for a while. I said, how did that work? She said, I knew the birthday of every nurse in every doctor's office in my territory. I had a standing order every day for birthday cakes, which I delivered on behalf of my drug company in the hopes that that nurse and that doctor would prescribe my drug, and therefore I would be financially rewarded. I said, how did you know if they ever prescribed it? Well, it turns out the drug companies can go to the local pharmacies, and although they can't get the names of the people receiving them, they can test the volume of sales in each of the pharmacies close to the doctor's offices. And that's one of the ways they measure their success. So let me ask and answer an obvious question. Why do the biggest pharmaceutical companies in America spend billions of dollars to promote and advertise their drugs? For one reason: it increases sales. It increases their profits. You see, patients are more likely to ask their doctor for a specific drug when they've seen the ad for it, whether they need it or not. That's why most countries have banned direct-to-consumer drug advertising. As I mentioned, only New Zealand and the United States make it legal. Why is it a problem? One reason is that it promotes overuse of medication for often benign conditions. That bit of dry skin that you have on your elbow, that little stiffness in your knee, hooray, there's a drug for it. And you're going to find out on your television set tonight exactly what it is. They push pills for every natural condition or cosmetic issue, and we waste money on unnecessary drugs, costs that every one of us pays for when the overall cost of health care goes up. Over the past 20 years, Since these direct-to-consumer ads have been allowed, the number of people with 5 or more prescriptions, 5 or more, in America has nearly tripled. But a primary problem with these ads is that they steer patients toward the most expensive drugs, and that raises the cost of health care. Drugs with ads have 9 times more prescriptions than those without. It just stands to reason. And what are the most advertised drugs? Let's take a look at a couple of them here. Humira. Humira, incidentally, a prescription for Humira from the disclosure of the drug companies costs $3,743 a month. Here's one you probably had to write down 3 times before you could pronounce it. Xeljanz, $3,100 a month, Pfizer drug. Humira costs $3,700 a month, Xeljanz $3,100, both are for rheumatoid arthritis. The drug industry spent over $100 million in advertising for each of the top 16 brand name drugs in 2015, meaning that 50% of all direct consumer advertising was just for these 16 medications. Do you ever see an advertisement during the Super Bowl for a generic, lower-cost medication? Of course not. It's the same story when it comes to the $20 billion the same companies spend to butter up the doctors so that they'll prescribe these drugs. Doctors are more likely to prescribe a specific brand name drug if they've been marketed by drug companies, while they're more likely to prescribe cheaper generics if not targeted with these ads. These ads often urge you to, quote, ask your doctor if this drug is right for you. Well, we asked the doctors whether direct-to-consumer drug advertising was right for America, right for the health of America. We went straight to the American Medical Association, the largest medical society in the United States. Do you know what? They've called for a ban on direct-to-consumer prescription drug advertising. Here's what they said, and I quote, direct-to-consumer advertising inflates demand for new and more expensive drugs, even when these drugs may not be appropriate. If a patient finally figures out how to spell Xeljanz or Xarelto on the 3rd try and comes to the doctor demanding these drugs, the doctor often has a choice. He or she can spend valuable time explaining why the patient doesn't need the drug, or why there's a cheaper generic, or just write the prescription. And sadly, too many doctors just write the prescription. Sometimes with these drug ads, it's hard to tell whether they're commercials for a pharmaceutical or a sports car, except you know the price of a BMW before you go to buy it. With billions in targeted spending on drug advertising, patients and doctors are bombarded with information, all those side effects. Be sure and tell the doctor if you had a liver transplant. But they're kept in the dark about one major important element. What do these drugs cost? Ultimately, somebody's going to pay for them. Maybe your insurance company, if you're lucky. If not, maybe you and your family. Price disclosure is absent from virtually all of these drug ads. So when a patient sees an advertisement for Xeljanz or Xarelto, or his family doctor writes a prescription for it, the moment of truth may only occur when the patient finally goes to the pharmacy and sees for the first time what they're facing. No other industry conceals its prices when it comes to consumer goods this way. And I think that needs to change. I think the American consumers have a right to know, in front, on the ads. Today I'm introducing a bill, Drug Price Transparency and Communications, DTC, to require the disclosure of prices in direct-to-consumer ads and promotions to doctors. The American Medical Association recently adopted a resolution supporting me. In addition to that, my bill is endorsed by the American College of Physicians and the Consumers Union. It's a simple thing. Do American consumers have the right to know when it comes to the cost of these drugs? The right to know that if you take Xeljanz for rheumatoid arthritis, that you're going to spend $3,100 a month doing that. This bill would have the FDA and the Federal Trade Commission oversee these communications and require drug makers to disclose the wholesale acquisition cost, known as the WAC, the wholesale acquisition cost of the drug. Now I'm sure the response from Big Pharma that makes a lot of money will be to say, well, that's just not the right price for every patient. I agree. But when we ask the pharmaceutical companies for better price information, they clam up. They won't answer. As long as they refuse to disclose the true cost of drugs and refuse to provide any transparency in the shell game they run between charging different patients different amounts, we have to stick with the one industry-reported, verified number, the WAC. And that price is what we have put in as the required advertising on each of these drug ads on television. I've asked a lot of stakeholders for their suggestions about other approaches. I'm open to them, but everyone understands this price establishment, this price bottom line, and that's why we used it. Further, my legislation allows drug companies to explain if patients would pay less than the amount that we advertise. But let's also remember, somebody's going to pay this high cost. If patients don't pay the WAC price out of pocket at the pharmacy, their insurance company just might, which is why health premiums keep going up. Blue Cross Blue Shield of Illinois told me that they spend more on prescription pharmaceuticals than they do on inpatient hospital care. This is one of the big drivers in the cost of health care. Is it important that we disclose to consumers what the real costs are of the drugs that they're being bombarded with on television? I think so. Doctors, patients, and families agree. If drug makers are going to fill the airwaves with pharmaceutical ads, then they should tell the whole story and provide clear information about drug cost.